Hey everybody, this is Evan, still taking it easy. This time from bed. Tonight, Dad's going to talk about my nighttime routine. Dad?
Here we go. Nighttime routine, we have several things that we always do. One of them, we have to replace his trach pad, which is kind of a gauze pad, a sterile gauze pad, not just any gauze pad that surrounds his stoma. And so I'll remove the old one. And then I've got some sterile saline. And then I've also got some sterile Q-tips, not to be confused with normal Q-tips, because the normal Q-tips, the cotton part of the swab might actually come off and go into his stoma. And then I very gently, although he probably won't think it's very gently, I go in with the cotton swabs to clean around the stoma, the area right around where the trach enters his hole. Stoma. And you know, once I've done that, and it's not usually that dirty, I take the new pad, and you see there that it's got a notch in it that it fits up over the trach. And what I usually do is kind of put a little of that sterile saline on it, and I'm going to put that side next to his skin. And he'll kind of he's not real keen on this because it usually puts a little pressure on his stoma and makes him cough, and as you can see, not very comfortable. So that's step one of the nightly routine. Step two is changing out what's called an HME valve. One of these little blue things here. And you don't have to worry about getting these backwards, they'll only fit one way. But anyway, we just sort of quickly disconnect here and disconnect there, and there's the old one. Put the new one in place and hook it up. So that's step two. Step three is to replace what we've already talked about once before, the suction catheter. They come in a package like this, and there's a little assembly to be done on it, not much. Just these two pieces, and this piece just goes on there. You make sure it's on there very tightly, and then it looks like so. And then we'll lay it back down on this sterile wrapper and take the other one loose. And a lot of these little fittings in this hose, they kind of like go together like plumbers sort of stuff. You know, they just kind of fit. It's not that complicated. But sometimes you can practice on them if you need to practice. And there's the catheter, and we put it in place. And then after I've given him just a minute to catch his breath, I'm going to replace his inner cannula. The inner cannula looks like this. It goes down inside of his trach, and we replace that usually once a day. Now the techniques for this is you kind of put it in, you take the old one out by twisting it slightly to the left, and then it will come out, and you put the new one in and twist it slightly to the right, and it'll kind of lock in place. Occasionally you'll run across one that just doesn't seem to want to go in very conveniently. Just relax if that's the case. If it, in fact, I'll sort of show you what I would do if I had one that didn't go back in place. You can see there I unscrewed it slightly and take that one out. Now just pretending for a second that this one wouldn't go in. You know, I can't quite get it in. It's okay. Just relax for a second, take a break, and even though the cannula is not attached in there, you can still attach his hose. Give you a second to kind of relax and gather yourself, and give him a moment to catch his breath and so forth. And he's breathing just fine, even though his inner cannula is not locked into place. And then you can, and after that moment, you can go in there and lock it into place. And you'll kind of feel it snap. And then put his suction catheter back on. And that's our nightly routine. We change all of that stuff every night, just to make sure that if there are secretions in it and so forth, that they won't reside there and have an opportunity to become bacterial.
And we also change the HME and the suction catheter on my wheelchair as well.
That's exactly right. We usually do that in the morning. We change all of this equipment in the morning. Now, one other thing that I will say, on his daytime assembly, you might remember that he's got that green valve that sits here, which is a speaking valve. Every week or so, I remove that green valve and sterilize it. We've got a sterilizer that we use to put equipment in, and I'll replace it with another one. But all of this equipment that we use, we try to cycle it and sterilize it. But these items, the items that I focused on tonight, they're the ones that we do every single day. Anything else you want to say, Evan?
Nope, that's it. We're going to bed.
Nighty night.